So if you are freshly passed out, what should you do? There are two things you have to see here. First, you want to go into teaching. You have a wealthy family. You directly go as a SR and work in a medical college as an AP. And if you don't want to go into teaching branch and you want to earn some money, there are three options. You join some fellowship, you work as an SR, and work in a charitable hospital. For SR and charitable hospital, this is to learn some basic skills. It will take up to minimum 1 to 2 years or up to 3 years depending upon the volume of your work. Fellowships can be of two types. First are Indian fellowships and then are the foreign fellowships. Indian fellowship is again divided into government, FNB. I am considering FNB as a separate one. Then there are private. Private fellowships are usually up to 1 year or they can be from few weeks to few months. And then there are foreign fellowships which can be done in Australia, UK, Europe or Singapore. Now we will discuss the government fellowship and the FNB fellowship. The government fellowship is usually of 1 to 2 years duration and there is an exit and entrance exam. Similarly, FNB is specifically of 2 years and there is an entrance and exit exam. The advantage of government fellowship is that it is of only 1 year duration. The diploma certificate is recognized if you want to apply in any government medical college, and you know the medical college whose exam you are giving, so you will get the admission in that college only. Now the advantage of FNB is that you can apply immediately after your post graduation, and then is you can settle abroad because it is recognized internationally. And then there is list of variety of medical college which you can choose from after the exam, and the competition is comparatively less in FNB. I know that because I cracked it twice. Now, coming on the disadvantages, first the government setup. The competition for the entrance exam is more here, and then there are some prerequisites like there should be 2 to 3 years pre-residency or the senior residency before giving the exam. For FNB, it is of long duration of 2 years, and then you can get admission in a wrong medical college. Like I got admission in a college for sports medicine who was having only 2 to 3 cases per week. So I left that college within 2 weeks. Now coming on to private fellowships, they are of 1 year and few weeks to few months duration. Two good 1 year fellowships I know of are in Ganga, Coimbatore and Ortho in Coimbatore. And they usually have more exposure and academically they are better. You have more hands-on experience and the diploma certificate has some value if you want to get admission in a corporate setup. Then the other fellowship you get familiar with a particular subspecialty. There are very few good fellowships in this category, and you can eventually get multiple fellowships and gain experience in various fields. And but the certificate in this category has less value. The foreign fellowships can be done in various countries like Australia, UK, in Europe, Singapore, and the overall they are better than the Indian fellowships, and you can get more hands-on experience in government setup. And the internationally and nationally, the certificate has more value because they are recognized. And if you want to go in corporate setup, you can get easily there. And after that, after doing the fellowship, you can decide if you want to stay there or come back home. Now, if you don't do a fellowship, you can either work in SR or work in a charitable hospital and learn some surgical skill. It will usually take about 1 to 2 years, depending upon the exposure. And after that, find a suitable place to settle. And that can be either a government hospital, either a charitable hospital, or you can go abroad. Now, the benefit of working in a government or a charitable hospital is that you will fine tune your surgical skills, you will develop a patient base there, and after you have sufficient patient following, then you can open your own setup or you can join a corporate hospital and do your own OPD if you join a corporate hospital, either a morning OPD or a evening OPD. You can go to UK by two ways, either MRCS or MTI. MRCS part 1 and part 2 are there.
Both can be given in India, and it has the benefit that there is good work-life balance in UK, and both the tests can be given immediately after MS. And in MTI, you usually require 2 to 3 years of experience, and no exam is required. And there is 2 years training there, and after that, you can either decide to come back or you can give MRCS exam there only, and you will find ways to stay there if you want. To go to Australia, you give the EMC exam. There is step one. After giving step one, you go there and work as a RMO. After working for 1 to 2 years, you can either give EMC step two, or you apply for orthopedic training program in various medical colleges there. And if they accept you there and they recognize your degree, then you don't need to give the step two. You can work there as a orthopedic surgeon as such. I like this way because AMC step 2 has a very low pass rate. To go to Dubai, it has an entrance exam, but you need at least 2 years experience certificate along with the logbook of the surgical procedures which you have done in the past 2 years. And the are that there are high salaries and there is no income tax there, and there is only one entrance exam. But the cons are that it is difficult for children studies there, and there is different language and there are stricter laws there. You can go to other Arab countries also. They don't have, mostly they don't have an entrance exam, but I don't prefer that because of obvious reasons.
If you are going to work in peripheral centers, you will have to do multiple things like trauma, plasticoscopy, and always read before doing surgeries because you are doing multiple kind of surgeries. And if you are settling in a big city or a metro city, you will have to go into subspecialization because now is coming a rise of super specialization. So you can be either an upper limb surgeon, shoulder surgeon, knee surgeon, foot and ankle surgeon, hand surgeon, then hip surgeon, arthroscopy and sports medicine surgeon, orthoplasty surgeon. Like that, there are various subspecialties. Here you will have to be patient because the patient base will develop slowly, and monetary wise, it will be a bit difficult initially.
Whatever you do, the most important thing is that you manage your finances. What you can do is, in the initial years, don't buy expensive clothes, cars, or watches, and save money and invest. And where you should invest? First, you can invest in learning, go to various conferences, short fellowships, and then is equipment and various surgical tools. And then there is the market investment. In market, you can invest in mutual funds, stocks. There are gold bonds. You can buy physical gold.
So this is a SIP calculator, a Grow SIP calculator. I usually don't use Grow app, but I use Grow SIP calculator. So suppose you are an orthopedic surgeon working in a hospital, you will be able to earn at least 2 lakhs per month. So you save 50%, that is 1 lakh per month, and then you invest it in, let's say, mutual funds, and you will be able to get at least 15% annual return in mutual funds, and say you do it for 20 years. So after 20 years, what you will be having in your bank account is 15 crores, you can see here. So if you are watching this video, you would be around 30 years of age. So it means you invest till 50 years, and at 50 years you will be having 15 crores in your account. So let's suppose that you change it to 30 years. You don't invest for 20 years, you invest it for 30 years. So you having in your account is 70 crores. So now you can change the return to 20%. If you learn finance a little bit, you will be able to earn 20% annual return. Now what you will be having is 233 crores after 30 years. So at the age of 60, you will be having this much amount in your account. And I think you can easily retire with this much amount in your account. I hope I did justice with the topic, and if you like the video, kindly like, subscribe and share, and see you in next video. Thank you.